Wacha nitatumia yangu ya chama.
Na ile.
Okay. Hey.
Well, good afternoon, ladies and gentlemen, my brothers and sisters from the Fourth Estate. Thank you for being patient while we finish a few things upstairs with Jackie Mugeni and her staff. This morning I've come here as chair of the Health Committee of the Council of Governors to brief the nation about the state of the coronavirus pandemic, especially in the counties, to lay some fears that might be there and expose the facts. I would also like to say something very important about the availability or non-availability of antiretrovirals in our country, on which we are working in concert with the Ministry of Health to ensure that our communities are not adversely affected by anything to that effect. The Council of Governors Health Committee today held a consultative meeting with HIV/AIDS high-burden counties to discuss the HIV stock-out concern. The meeting resolved that antiretrovirals have to be availed to the people urgently, because currently there are counties with zero HIV commodities. This is very dangerous. This therefore means that the viral suppression of the people who are taking Arvs is compromised and increases their chances of dying due to HIV-related complications. Currently, there are serious challenges with pediatric ARV regimen. That is a regimen for children, particularly the newly born one. The component of this regimen, called Kaletra, is missing in totality in the country. This means that children are not accessing the full range of ARVs. This will lead to treatment failure among the children. In this regard, the meeting has requested NASCOP to provide guidelines directing the inclusion of nevirapine into the pediatric regimen. We note that changing of ARV regimen in the short term is not advisable, as it will lead to resistance to the drug. And that is dangerous to health. We also note that currently we are not able to test for viral load. This presents a gap in the fight against HIV and is likely to result to more HIV-related deaths. In the long term, the counties are committed to discuss the sustainability of HIV interventions in the country. In light of declining development partner support, there is need to increase domestic financing and production of ARV commodities. I'm quite sure that the Kenyan economy and the Kenyan people can afford to do this, if not immediately, but in the long term. Therefore, the Council will convene an urgent intergovernmental meeting on Monday, 12th of April, 2021, between the National Treasury, the Ministry of Health, NASCOP, and other relevant stakeholders to discuss the prevailing situation and agree on the process that will initialize preparations of long-term measures. In the last 1 week, ladies and gentlemen, there has been a decline in the COVID-19 infections, bringing the positivity rate to 15.1%, down from 22% in the previous weeks. This indication of good progress in combating the virus in the country, which is attributed to the lockdown and stringent measures introduced by His Excellency the President. We therefore urge members of the public to continue adhering to the preventive measures in place. On the other hand, the national and county governments will continue to enforce the health protocols to further reduce the positivity rate in the country. In the last 1 week, the 47 county governments have addressed themselves to the following critical issues. 1. Status of bed capacity in 15 counties. The bed capacity in 41 counties is as follows. There is a total of 8,073 beds in 888 isolation centers, out of which 6,159 beds are available for patients. There are a total of 417 beds in the ICU, out of which 259 beds are available for new patients. And there are a total of 196 beds in the high dependency unit, out of which 104 beds are available for new patients. Secondly, the status of oxygen supply. In the last few weeks, there has been tremendous focus on the shortage of oxygen supply in the country. Indeed, there was a report not too long ago that our national referral facility, Kenyatta National Hospital, had acute shortage of oxygen. The people of Kenya would like to know what the status of oxygen supply is in our counties. Let me inform the nation that cumulatively in 47 counties, there are 58 oxygen plants, out of which 42 are functional. A total of 2,828 oxygen cylinders and 730 concentrators are available. Additionally, there are 3,601 isolation beds connected to oxygen across the 47 counties. We advise every county which may have oxygen shortage or a shortage of oxygen supply to inform the COG Secretariat, and we are able to work with each one of our counties, especially in areas where the prevalence of coronavirus is very high, to ensure that these oxygen facilities are available. 3. COVID-19 vaccination. Cumulatively in 41 counties, a total of 395,096 doses have been received, out of which 341,520 doses have been administered as follows. Healthcare workers, 70,883 healthcare workers have been vaccinated. Security personnel, 120,975 security personnel have been vaccinated. Teachers, 33,759 teachers have been vaccinated. Others, 115,903 have been vaccinated. In other words, the first tranche of vaccination has been concentrated on frontline workers, which include healthcare workers, security personnel, teachers, and others in critical positions like people doing security, government buildings, and so on, are included among others. We urge frontline workers and the elderly who are yet to be vaccinated to ensure that they receive the jab as the same is aimed at reducing severe illness and death from COVID-19. By the way, among others, I will include leaders like ourselves who are to vaccinate, to encourage others to vaccinate. I remember in my county, healthcare workers were very reluctant to vaccinate, to be vaccinated, until I did so, and then the next day the numbers went high appreciably. 4. Testing and home-based care. Out of 102,980 tests carried out in 41 counties, 15,007 tested positive. Of this number, 5,856 positive cases are under home-based care, while 771 are in isolation facilities across 47 counties. A total of 35,050 have recovered from COVID-19. In other words, the recovery rate in isolation, even among hospitals, is very, very impressive. 5. Renewal of contracts of healthcare workers. In order to ensure smooth delivery of services during this pandemic, the Ministry of Health, through the Public Service Commission, in consultation with the Council of Governors, has granted authority for renewal of contracts of all the healthcare workers who are engaged in the management of COVID-19 across the 47 counties for another 6 months, commencing April to September this year. Further, the ministry is working closely with the county governments to ensure that healthcare workers who terminated their contracts are replaced immediately to ensure that service delivery is not affected. The two levels of government are in discussion to see if the contracts of the health workers still in service can be extended for 1 year. 6. Implementation of county COVID-19 socio-economic reengineering and recovery strategy. As you know, ladies and gentlemen, sometime last year, the Council of Governors initiated a socio-economic reengineering recovery strategy for all the 47 counties and provided every county with a strategy to re-engineer county economies following the ravage of COVID-19. The balance sheet is as follows. County governments have embarked on implementation of the strategy, which aims at supporting key sectors as well as creating innovative interventions that seek to address the varied implications of COVID-19 to the economy. The strategy and the intervention will vary from one county to the other, depending on the local situation in every county. And you know, our counties are not similar either in terms of geo-economic potential or actual institutions that they have that can be used to intervene in re-engineering those economies given the ravages of COVID-19. So far, 5 counties, namely Nakuru, Embu, Lamu, Machakos, and Nyeri, have rolled out interventions which have multiplier effects on productivity and employment creation. Others who have done so and have not reported to the COG Secretariat, we plead with them to do so as soon as possible so that our records can be up to date. These initiatives include tax relief in the following areas: waivers of penalties, land rates, market fees, border fees, and trade license. 7. Food security. We affirm that there is adequate food supply in the country, and prices have been retained in most markets across the 47 counties. Food, as you know, at this point in time, is an extremely important item in the daily diet or the daily life of our people. However, the delayed long rainy season has affected all counties, especially ASAL counties. These counties are now tracking water, providing relief food and cash transfers to support the affected families. These counties are doing this in very difficult circumstances, since the equitable share from the National Treasury has been delayed for 4 consecutive months. Therefore, to enhance the efforts of the county governments, we call upon the national government, development partners, and the private sector to support counties to ensure the affected citizens have access to basic needs. 8. County governments call centers. In the wake of the 3rd wave of COVID-19, counties have reactivated the 24-hour toll-free call centers. For example, my county, Kisumu County, has reloaded our call center to handle a bigger capacity of calls. 9. Transport sector. County governments have continued to enforce the health protocols by providing hand washing and sanitization facilities at the bus stations and stopovers along the transport corridor. We encourage both the operators of transport facilities as well as passengers to please make use of these facilities. They are not there for show. They are there to help us save our lives. Additionally, ad hoc and impromptu roadside health checks are being undertaken in all counties to ensure compliance with government regulations on COVID-19. Further, counties have enhanced surveillance activities, including 24-hour surveillance at border points, as well as within the community using syndromic screening. Counties have also strengthened inter-county information systems for tracking and data sharing. Ladies and gentlemen, notwithstanding what we are doing, we are facing some major challenges which I'd like to share with you. The first challenge is disbursement of county equitable share of revenue. The elephant in the house. Despite being in the middle of a pandemic and 2 months to the end of the financial year, county governments are yet to receive their equitable share as follows. 7.2 billion shillings owed to 12 counties for the month of December. Those counties didn't have a happy Christmas. 26 billion shillings owed to 47 counties for the month of January. 26 billion shillings owed to 47 counties for the month of February. 26 billion Kenyan shillings owed to 47 counties for the month of March. This delay, ladies and gentlemen, has continued to slow down timely response to COVID-19, and the other county operations have been impacted negatively. In this regard, the Council of Governors now strongly notifies the National Treasury that this inordinate 4-month delay may lead to other drastic actions, since negotiations seem not to be heeded. Council now demands for immediate disbursement of all the outstanding amounts owed to county governments before the 15th of April this year. 2. Traffic in border points. We note with concern the heavy human and truck traffic at the border points, which poses a great risk in increasing community infections. We therefore urge the national and county government to ensure speedy operations at border points to avoid overcrowding, taking into consideration road safety for freights and passenger movements. 3. Waste management. We have recently seen the disposal of used personal protective equipment, PPEs, in the general municipal waste stream that is generated within urban areas. These kits, which are highly infectious, let alone at times carcinogenous, are being won by garbage collectors, hence posing a risk of contracting the virus. To avert similar eventualities, county governments have strengthened their enforcement measures to ensure that medical waste is managed in line with the Ministry of Health protocols and regulations. So far, 23 counties have equipped county general referral hospitals with autoclaves, while 11 counties are using microwave and 3 counties are using incinerators to facilitate treatment of medical wastes generated in situ. In as much as possible, the use of incinerators should be discouraged, if not totally abolished, because in certain counties materials are washed, like sheets and so on, and hung on lines not too far from where incinerators are emitting extremely carcinogenous smoke. This can easily increase in-hospital transmission or acquisition of certain diseases. In conclusion, ladies and gentlemen, we are hopeful that through concerted effort, we will start to see the decline in the number of reported cases in the coming weeks, for the curve to be flattened. Every Kenyan is wishing that this curve is flattened. It is the responsibility of every Kenyan to observe the protocols for preventing the coronavirus. County governments remain committed in the fight against COVID-19. However, we urge every individual to do the following. 1, continue wearing masks properly by covering the nose and mouth. Mine is not covered because I'm reading. In a moment I will do so. 2, maintain social distance. 3, wash hands regularly with soap and running water. And finally, sanitize. Asanteni sana ndugu zanguni. If somebody has a question for clarification, you are welcome. Can I have that fellow who was carrying my water?
You've mentioned that there are countries with 0 HIV commodities. Maybe you can give us the names. And then also yesterday, Treasury talked of waiving tax exemption for this commodity. Have you found received any communication from the national government regarding when you're supposed to receive?
We have received that letter from the Ministry of Health as a public statement, and of course we are meeting on Monday with the Intergovernmental Response Committee, and we hope that that can be clarified for purposes of implementation. But referring to a county where there's 0 supply of ARVs for children, you should go to Homa Bay in the sub-county of Suba. The CEC in charge of health this morning told us that in Suba sub-county, ARVs are 0, whether for children or adults. So that's a very, very serious situation. Any other question? Yes, sir?
My name is Josh.
Yes, Josh. Yes.
I really need a clarification on the number of ICU beds in the 5 counties locked down. Number 2, we see the government borrowing money from outside. And maybe can you confirm how much is needed in the counties, especially in this fight against COVID?
Government borrowing money from where?
For example, the external borrowing.
Well, look, I'm not informed about the external borrowing affecting the counties. Something that is not easy to answer. I think you better ask 1, the Secretary to the Treasury, and 2, the Minister for Health. The 2 of them should be able to clarify that issue, because they are the ones first in charge of the source of money and secondly in charge of spending it in health.
On the side of the ICU beds.
ICU beds in the lockdown countries. You know, Nakuru has a problem, and the governor said so. So the lockdown countries are a special category because in these lockdown countries, the number of people needing ICU beds has been going up exponentially. But I think the intervention taken should ensure the flattening of that curve in the highly infected counties.
And for regards to the TV,
Yeah.
I just want to in terms of the oxygen. You mentioned that there are 42 plants that are functional in the counties. Just want to know, is this enough? The counties, especially the referral level 4 and level 5 hospitals, are having enough oxygen? And if you can paint us the situation, but again, the minister said the other day that we are having a shortage of oxygen in the hospital. What is the status?
Well, look, we had a meeting specifically on oxygen last week with all the CECs and the oxygen suppliers. And we did agree with the oxygen suppliers that they should now concentrate on giving health-related oxygen, not manufacturing industrial oxygen, so as to create space for demand from the counties for this oxygen. So what we are saying is where we know that 42 counties has no problems at the moment, that in the event that there's a problem, we would like to know so that we take necessary interventions. That's one of the reasons why we're meeting on Monday in the Intergovernmental Committee with the Ministry of Health to review these responses week by week because things change. Vindu vichenjanga. Thank you very much, ladies and gentlemen. Have a good lunch.